Hello, I'm Shubha. Like you, I work among people whom I care for, and I take pride in my job. Today I'm going to take you to meet some people I know, to share what I have learned with you.
I told you so. See?
Something's happening at Ramesh's home.
You've been coughing like this for so many days now. Why don't you go and show it to a doctor?
Oh, it's just a simple cough, and who has the time to go to a doctor?
Ramesh, maybe Lata is right. Have you been coughing for a long time? Sometimes we believe it's nothing serious, but we won't know for sure until we've done a test. I know you have a lot of work, but a few minutes of your time may make a big difference to your health. Remember,
Persistent cough for more than 2 to 3 weeks could be TB. Other symptoms are weight loss, fever, chest pain, coughing of blood, swelling of glands in the neck, armpits, groin, or abdomen.
if you have any of these, you must get checked for TB. Anybody, young, old, rich or poor, can get TB. I'm very fond of Shabana. She's studying hard to become a health worker. Let's go say hello to her. She's fallen asleep. What is TB?
TB is an infectious bacterial disease. The most common form of TB affects the lungs, but it can also affect other parts of the body such as lymph nodes, abdomen, bones, joints, and the nervous system. TB germs usually spread through air. When a patient coughs or sneezes, people nearby can breathe in the germs and get infected with TB. Remember, if you have TB, don't give it to your loved ones. Cover your mouth with a cloth while coughing.
And most important, take regular treatment. Jayant works in a laboratory. His job is to look through this gadget called a microscope and see samples of blood, sputum and tissue. He can even see the germs that cause diseases. Jayant, what are you looking at?
The TB germ in a patient's sputum sample, Shubha.
So, can you definitely tell that the patient has TB?
Not with just one sample of sputum. You need to collect 3 samples. Sputum tests and treatment at government and municipal centers are free. On the first visit, 1 specimen is collected at spot and the patient is given a container to bring the early morning sample the next day. When the patient comes the next day, the second spot sputum is taken.
Now remember, it takes 3 sputum samples to confirm a TB diagnosis.
Oh my gosh, I almost forgot. Today is a very important day. The first day of Prema's TB medication. Prema, why aren't you ready yet?
Actually, Shubha, Mohan feels there is no point in my starting all this treatment. Heaven knows how long it'll take. And then, how will I go there every time for the medicine?
What if the medicine doesn't work? If she has to take it, why can't she buy it from a shop and take it at home?
I understand how you both feel, but trust me.
TB is completely curable with DOTS. If you complete the entire treatment and are regular with the medicines, in 6 to 9 months, you will be completely cured. TB medicines are to be taken by the patient in front of a DOTS provider. A DOTS provider brings treatment closer to your home. For the first 2 to 3 months, the medicines are to be taken 3 times a week in front of the provider. After that, fewer types of medicines are needed for the next 4 to 5 months. At that time, only 1 dose will have to be taken in front of the provider, the rest at home. TB patients are categorized into one of 3 treatment options. A DOTS provider will help in giving medicine at regular intervals. Remember, every dose is important.
Mohan, it will be easier for me to take my medicine in front of the DOTS provider. At home, I may just forget.
Well, I suppose so. Prema, you're so absent-minded that you may mix up the medicines at home. Today you put salt instead of sugar in my tea. Shubha, yes, I think I'd feel better if she takes this dot spot stuff under supervision.
I'm happy for Prema. I will go often to make sure she doesn't give up her medicines. Shubhana, you woke up, my dear? Why are you so low?
Shubha Didi, I have so much to study. I sometimes feel like giving up.
When one is doing something important, sometimes it gets difficult. But one has to find the determination to keep going. I too have days that are not easy, but I must persist.
How do you do it, Didi?
By reminding myself that if the people I work with can have patience and determination, so can I. They inspire me. Take the case of someone who is on TB treatment. They must persist, though the medicines may have side effects.
Yes, I studied about that.
One could get a stomach upset, orange-colored urine or drowsiness, or more severe side effects such as burning sensation in the hands and feet, joint pains, impaired vision, ringing in the ears, loss of hearing, dizziness, jaundice.
How do you then convince someone to continue their medicines, Didi?
The drugs are very safe and effective. When taken properly, they can completely cure a person of TB. If urine is discolored, it means the medicines are working. Mild dizziness is likely to disappear within a few days. The health worker must be told if there are any problems. These can be addressed. That's why it's important to take the medicines under supervision.
It's always so nice talking to you, Didi. You're such a good listener. And you understand that people may have fears. And you're there to reassure them.
Now off you go, flattering me to escape your studies. It's been a long day. It would be good to go home.
Shubha, wait!
Huh?
You're just the person I was looking for. Do you know why Nizam has not been coming for his medicine?
No, but let's go and find out.
Ah, Shubha Appa. Hello. Come in, both of you. Just in time for tea. And have some sweets too. I have been feeling so good that a daily halt at a sweet shop has become a must. Those medicines have worked. I don't need them anymore.
Nizam bhai, I'm really happy that you're feeling better. Often, after starting TB medicines, one feels better. For instance, the cough stops or the fever subsides. But improvement in symptoms does not mean your TB is cured totally.
If Nizam Bhai stops the medicine, it'll become more difficult to cure his TB. And more expensive too. Besides, he may be spreading the more dangerous germs to his loved ones.
So, if feeling better is not a sign of being cured, how will I know if I am getting better?
Nizam bhai, regular sputum tests will show how you are progressing.
Remember, you can be fully cured if you take all your medicines as prescribed and complete the entire course of treatment.
So, there is no need to celebrate as yet.
Of course you must celebrate, because you will soon be well, and because you have such a wonderful family that helps you to take care of your health. Let's have some more of those sweets. Right, Mahesh? There are good days and sometimes not so good days, but I love my work. It's not just that I can help people with TB to fight the disease. It's about the trust they place in me and the sense of responsibility that brings. A job that's challenging, but deeply satisfying. You can do it too. And you will find, like I did, that it's not very difficult. And that in fact, it's just all in a day's work.